guys, Heather here. So what are some tools that nursing students could carry around with them during nursing clinicals to help them to be prepared? Well, how about scissors? Yeah, I want to talk about the sharp objects first. Didn't your parents ever tell you not to play with scissors? My mom didn't like me playing with scissors. So one day while she was taking a nap, I got a pair of scissors and I cut a slit in my baby blanket. And then I chopped off my bangs, and sometimes I would go in the backyard and give the grass a haircut. And I can't remember if I got in trouble for that, but my mom sure did pay me back by taking a lot of pictures of my crooked, non-professionally cut bangs, and I hope she didn't take me out in public too much. So the most common thing that I use scissors for is to cut a lidocaine or a nicotine patch packaging, because you can't really rip it open. I've tried. Or Kerlix, which is like a gauze bandage that you wrap around an arm or a leg to secure a dressing. And that's pretty much it. So if you don't have your scissors with you and you decide to maybe unwrap the Kerlix without cutting it, you might be unwrapping it for quite a while. And you know what? Sometimes I'm at default for not having scissors with me, and I actually have to go into an isolation room and I forget to cut my nicotine patch, and then I have to derobe my isolation costume and go to the nurse's station, find some scissors, cut the patch, and then dress up back in my isolation costume and give the patch to the patient. But, I will tell you this. Before you cut the nicotine patch, ask the patient if they actually want it, because some patients actually refuse, and then if you cut it, you can't return it. The next item is paper tape, and I actually don't have paper tape with me because at the hospital I'm at now, I'm lucky enough that they keep it in a cupboard in the patient's room. How convenient is that? And what we mostly use tape for, drum roll please. I do not know how to make a drum roll sound, but it's mostly used to secure dressings on the patient, or after removing an IV, taping gauze to the IV site, or to secure the IV tubing onto a patient's arm so it's not flapping around. Next item up for auction is the pen light. Not used to blind people, but used to see if the pupils are equal, round, and reactive to light, and I really hope mine are. The next item is my favorite, the stethoscope. And it's my favorite because it's got a candy red heart on it. Love it. I think we all know what this is used for. And here we have the popular alcohol swab. You should grab a handful of these before every shift. Mostly used to clean off the hub of an IV to kill the germs before connecting any IV tubing, or to wipe the patient's skin before giving an injection. And this is also a very resourceful item. It's an adhesive remover. It's called Unisolve, and it works really well when taking off, tape, plastic tape, paper tape, whatever, off patient's skin, because some patients are really sensitive and sometimes it sticks really well. You can also use an alcohol wipe, but this stuff's amazing because it has oil or something in it, but it works really well. And the last item is the saline flush. Have you ever been in a patient's room when the IV starts beeping and the line needs to be flushed, and guess what? You don't have a saline flush with you. So that's why it's always good to have one of these with you. So those are some of the essentials to carry around with you as a nursing student and definitely as a nurse. Well, thanks for watching, everyone. Have a great day. I'll talk to you soon, okay? Bye.